All right, we're all set.
Okay, great. Thank you. My name is Jeff Griever, as Rachel had mentioned, and I'm the Community Engagement Program Manager at the Center for Clinical and Translational Science. Today, we are going to talk about engaging stakeholders in research and how community engagement program here at the CCTS can help support your research. So we'll get started here in just a second. Making sure that, okay, so there's the issue that we're seeing in research is that often people are not engaging stakeholders in their research, and that time and resources that are invested in research frequently do not include engagement. That's a heavy investment in early science and developing and testing interventions, less investment in taking tested interventions to scale, or interventions end up never being used and just sitting on the shelf. And so we hope to show how engaging stakeholders in your research can help to address these issues. So why does this happen? Often the work is not aligned with the priorities of your stakeholders, of your study population, or the solutions that we come up with are proved to be either too costly or too difficult or complex to be implemented in practice. But why do we learn this sort of at the end of the project? And that goes back to actually engaging your stakeholders so that they can help us understand the best way to address issues of priority, identify issues of priority, address them, and in ways that are sustainable and in line sort of with how the stakeholders would like to see things be addressed. So just as a quick definition for stakeholders, it can really be a variety of different possibilities, really depending on your research. It traditionally is thought of as patients or families of patients, but it can end up being whole communities or caregivers, specifically specific cultural groups. It could be clinicians or other researchers, whole healthcare systems, or payers or insurance companies, policymakers. We can impact policymakers to make changes to improve health in various ways, industry. So there's just really, it's important to identify who your stakeholders are at the beginning to help to then reach out to them and see and get their input as to how you go about trying to solve issues in that particular community. So if we look at the sort of the research continuum, as we look at sort of the lesser side of involving stakeholders, it's entirely investigator-driven research. The next sort of step up would be to do research out in the community. Then we get to like community-based and community-based participatory research, which is engaging the community a little more traditionally, having them be more involved in the way that the research is conducted and then ultimately sustained once the research is over. But the ideal to get more stakeholder involvement, to get the true full benefit of it, we want to see more of like community driven research and that CBPR, those last two on the right, so that we know that we're addressing issues that really matter to the people that we're trying to help, and then in ways that sort of make sense to them and that really connect with them. And if we can get the community to help lead our research, then we get buy-in from them and they have a sense of ownership, and therefore once the funding is no longer there, there's more motivation and more willingness and ability to sustain what we have achieved. And so anyway, that's sort of what we're looking at here with this line. Hold on, this is a little clunky, but it's working, so I'm going to keep doing it here. But so when should you engage stakeholders in your research? And I think that the first place people often think about is at the dissemination phase of the research. That could be as simple as getting published in a journal, so it's out there for people to find. However, that ends up often being mainly, as you might expect, just for research peers and not so much for the lay person or the people that we're in our study population or our stakeholders. And so really what stakeholders can help us do when we bring them in to sort of serve as a community or stakeholder advisor is to help us understand how do we convey this information in a way that makes sense to a non-scientific person or a lay person, but also like how do we best distribute and make sure that people get this information, because obviously if we aren't informing the people that we're trying to help, it may not really ever reach them in a way that could have the biggest impact. And when you really think about it, I mean, who has more of a vested interest in your results than they do? And so that's really an important thing to consider and to work toward. I suggest that we try a little sooner. At this data analysis, you've collected your data and you're trying to make sense of it, come up with your conclusions. And, I mean, what I'd like to see and what we would like to see is just how do stakeholders, what do they think about your analysis? Do they have any input that might shape your conclusions or direct future projects? Data might look to somebody who doesn't know what it's like to be the person that we're, the population or the stakeholder that we're trying to help. They might come to a different conclusion until something is maybe brought to light or something is cleared up that helps really show what's happening with what we found. And so I think it's a really important part of the process, to engage your stakeholders. And so we look here at sort of this middle stage of the research process, the initiation of the project and recruitment, the implementation of the project and sort of maintaining throughout as the project and collecting data and so forth. So, what would it look like here if we're engaging them? And really, stakeholders can serve in an advisory role or as part of the research team. They can help with recruitment, implementing and maintaining the project, and also, like I was talking about before, helps with sustainability after the project concludes. So they don't want to see something that works and that is helping go away or die. So you really have that by giving them an opportunity to be a part of the team and then to take ownership over the research project really is where that really contributes to that sustainability that we're looking for. At the sort of when you're writing your grant and the grant review and the IRB review are happening, this is also an important place where stakeholders can get involved and provide input and feedback for your grant submission. And it's really important, particularly if there are community representatives on the review committee. And so, if you think about, we're seeing more and more the RFAs, RFPs that are being put out by the NIH and other funding sources are requiring the engagement of stakeholders. And so if you think about the various ways you can sort of check that box, one would be to say, this is who I'm going to reach out to, this is how I'm going to do it. Another would be to put in your application, this is the letter of support from the organization that says they're going to work with us. But the last way that I think is the strongest and makes for a stronger application is to already have engaged with the stakeholders so that your application, your submission can show how they've already worked with you and how they've made your project stronger than it would have been had you not engaged with them. Because then it's not a promise, but it's actually already in place. And that relationship has already started and the research is already stronger as a result. So if we get different submissions for funding and we see one says they have a letter of support that says they're going to work with stakeholders and that project is scientifically the equivalent, an equal equally strong application is one that's saying, we've already worked with the stakeholders, and here's how we know this is the right question to ask and the right protocol. And it's really going, you know, because our stakeholders are involved, they were part of it throughout the whole process. And so I really think that that is something to consider sort of at that stage. But, you know, if we really even just go back to the very beginning, that coming up with the study design and the research question, it's, you know, you have an idea of what you want to study, but when you're sort of formulating what question are we going to answer and how are we going to set up, you know, our study design, the stakeholders can be really invaluable and sort of, you know, with their feedback. Does this data really represent what's important to your stakeholders? What is important to them? How will they adopt your solution if you're successful? How could it be more on point with their needs and priorities? These are sort of the questions that we want to answer that will lead to stronger research. So, you know, when it comes down to it, I think the answer to when should we engage stakeholders is that we need to really involve them throughout the whole process. So, you know, if we engage with our stakeholders, we can avoid some of these pitfalls. We can improve the relevancy, making sure that we're aligning with the priorities of the people we're trying to help. We can improve the strength of grant submissions, as we were talking about sort of in summary here. They improve the ease of implementation when we have them sort of become part of the research team, improve sustainability because of that ownership feeling, that buy-in that we get from our stakeholders, and improve the impact and result in better health outcomes overall. And so, you know, we really encourage you to consider this. How can we in the community engagement program help? We can help to identify stakeholders. We can help to set up community advisory boards or provide community advisors or stakeholder advisors for your team. We conduct something called the Community Scientist Academy. And what that is actually we go to the community to find people who are interested in serving in these types of roles. And we teach them about the research process, that translational research process, so that they understand it better as a layperson. And then therefore their feedback maybe can be a little bit more direct or on point because they understand all the different stages and all the different things that the research teams have to go through in order to be able to conduct successful research. And so that's what the Community Scientist Academy is. It's like it's a 5-session or once a week for 5 weeks where we teach them at the various stages. And as far as the researcher side, the involvement includes bringing a guest speaker to every session to talk about that day's topic, whether that is grant funding and getting research funded, whether it's the IRB day where we talk about regulatory protections and how research goes through the approval process, whether it's you know, study design. We have these different, you know, days with different topics, and we try to bring then a guest speaker in sort of for the last third of the session to talk about and have an open conversation with the group about the topic of the day within the context of their experience. So it's not really like a traditional presentation of a research project where you say, this is what we wanted to study, this is how we did it, this is what we found, but it's more so when we went to get funded, this was our experience. And then if you had stakeholder input, how did that strengthen your funding application? If you didn't, how could it have strengthened your application or your submission? You know, so that really diving into that topic with some real world experience from the researcher. And then we're also connecting, we're bringing the community to speak with a real researcher and, you know, and to have a bi-directional conversation, and maybe even identifying stakeholders that could work together with that particular researcher, or at least maybe there's a way to make a connection through that experience. And so anyway, that's sort of the Community Scientist Academy as a quick overview. But we also have this thing called Science Cafes, and that's really when we have a need for, you know, disseminating information to the public or to stakeholders in the community. We might have a community organization come and say, we'd like to learn more about the latest information related to diabetes or heart health or whatever the topic might be, and we can then find a researcher or expert and bring them to that group to talk about it. Or we can have researchers say, I'd like to reach out to the community to share what we've found. And excuse me. And so that's sort of what the Science Cafe thing is about. Community engagement consults, so that's more of like a one-on-one with your research team, with either me or Beverly or both of us, that we provide, so to get more specific with what are your needs and which populations are you trying to reach, and how to best go about doing that. And we can also help connect with community partners and stakeholder organizations. So really, that's a quick summary of what we have to offer. I think that I like to sort of drive the point home with a couple of examples that I like to share. One of which is we've had researchers that want to work in communities where they're struggling with opioid addiction, and they might, for example, they might go in and say, well, we have a prevention program we'd like to bring to the community, and we see that, I'm just going to start because I'm sort of mixing a few projects together and examples together, but just to make the point. But if you're targeting maybe ages 20 to 45, because we're seeing a lot of issues in that community, you might go to the community and say, this is what we have. We have this prevention program idea that we want to address. And their response might be, well, we'd like someone to actually go into our high schools and talk to our children before it ever becomes an issue. We recognize that a lot of people in the ages of 20 to 45 might be struggling with the issue, but if we're talking prevention, it'd be nice to get to our kids before it really becomes an issue, and see if we can reach them earlier. And so that might change the entire way the research project is conducted. It's not changing it from a prevention program, but it's looking at it like, maybe this would be more impactful, or maybe it's a combination of both. Maybe you take what you thought you were going to do with the 20 to 45 group, but also have some aspect of reaching kids and reaching them sooner, so that you can sort of meet the community in the middle where they are, and also still achieve your goals and to help improve health in the community as a whole. So anyway, that's just sort of an example that I sort of like melded together several real examples just to sort of illustrate the point about how reaching out to them at the beginning and getting them involved can really help. But I'm certainly more than welcome to answer questions. I think we should probably have Beverly give her presentation first, and then the both of us would be able to answer questions. Rachel, do you think that would be the best way to approach it, or?
Yes, I think that makes sense.
Okay, so.
Okay, I'm Beverly Stringer. I'm the program director for community engagement in Southeast Ohio. Next slide. Our mission here in Southeast Ohio is improving the health of our communities through community engagement. And we do have a lot of health disparities here in Southeast Ohio. Community engagement plays an important role in linking OSU researchers with the communities and connecting the communities with the researchers, because sometimes we do have requests come from the community themselves. Next slide. Community engagement of Southeast Ohio. We encourage community involvement, like Jeff said. If we could get it at all levels of research, that would be excellent, because actually our community members are the best experts on themselves as to what their needs are. They can help you identify and prioritize your problems. They can provide input into relevant research questions. They can contribute to research design methods, developing cultural sensitivity and ethical proposals. And one of the things we've discovered, even from county to county, we have a lot of like issues, but we also have a little bit of different personalities in these different counties. And so what may work in Scioto County may not work in Jackson County. And having the input from the community is so important to be able to identify that. And we can enhance the recruitment and retention of participants, and we can help with implementing and disseminating research findings. And it's very, very important when you're working with a community, after you have your findings, to bring them back and let them know what you found out, because otherwise you're leaving them hanging. Next slide. I am actually located in Portsmouth, Ohio, down on the tip of Ohio. I'm embedded in the community, of course. I was born here, raised here, live here, raising my family here. And one of the things where I rent my office space, as you'll see, I'm at the Scioto County Welcome Center, and it is down on the river. As part of that, I have availability to our administrative conference room in the building, and that is at no charge. So I have actually reserved this room to help some of the researchers when they come down to either talk to a small group or even do training for some of their staff that they've hired locally. The other thing that's really nice about this is the Welcome Center houses other entities. I'm not the only one here. The Chamber is here, Main Street, Portsmouth, of course, the Welcome office. And sometimes when there's meetings, I get to run into people that I normally would not have run into. Next slide. Networking in Southeast Ohio, I do belong to several different groups in several different counties, and that helps me to see what's going on. And then also, when we have a researcher approach me, then they have needs, they want to come talk to a group. I'm already a part of these groups, so I know where they are and when they exist, when their meetings are, and I help them get on their agendas. Here's a list of my contacts: Scioto County Health Coalition, Pike, MEGS. I'm in Jackson County with their Spark group. In Pike, again, with the Healthy Lifestyle Initiatives. I belong to some boards locally, the Counseling Center, the Compass Community Healthcare, and we have a board of our own that we created, and it's the Southeast Ohio Advisory Board. And there's 20 members, and we meet quarterly. We also have access to, I have recruited community partners from Southeast Ohio. It's we have 45 of them. It's a diverse group in quite a few different counties. Next slide. I apologize for my voice. For some reason, I woke up this morning and my allergies are acting up. But anyway, our community partners, they have a lot of capacity to participate, and they can be consulted about research priorities. We've had researchers come down to our advisory board, and they have actually put forth some ideas and got feedback from the group before they got their project up and running. The wonderful thing about our stakeholders, they're well respected, valued, and rewarded. Like I said, they're the experts. They live here, and they can help with effective implementation and dissemination. And they can increase the public support for research. Instead of just coming and making a cold call, you can actually work through networking with others, and that opens more doors than if they do have no idea who you are. And of course, we're all working towards the same thing, which is improved health and well-being of our communities. Next slide. Our community, next slide. Our community advisory board, I'll go ahead and talk about it. Consist of community members in several different counties. There are 20 who sit on this board. They give important feedback to the researchers, and it gives the community a voice to talk to the researchers themselves if they find a need, which is possible. When we have these meetings, we usually do have guest speakers, but at the very end, we have an open networking, and there have been some really good, fruitful conversations that have led on to other research projects with the research community. And also here, they can come back and disseminate their information. Rachel?
Yeah. Can you hear me?
Yes, I can now.
Yes, I'm sorry about that. I'm trying, I think I kind of lost control of a few of my abilities here as host.
You want me to try to take it?
Did I miss one of your slides?
Yeah, I'm actually over to Community Engagement Board of Southeast Ohio. So I'm 2 slides over.
This one? This slide?
No, the next one.
Oh. The Community Engagement Advisory Board of Southeast Ohio is what's showing up on my screen. Is that one?
Oh, mine just shows community partners.
Yeah, we can only see community partners.
Okay, let me stop share and bring it back. So
I'm actually ready to go to the slide that says projects, community engagement.
looks like my computer, it's not wanting to work with me. Do you see any slides right now, or did I stop?
No, I don't see anything.
Okay. It's not bringing up the Zoom controls for me.
Do you want me to try?
Yeah, do you mind? It's not, I can't even see any of the Zoom features.
Well, I
have it here. Do you want me to do it?
Jeff, will you please?
Yeah.
Because it wasn't pulled up on mine.
All right,
Thank you.
Do we see the presentation here?
Yes, go back to projects, community engagement. You'll see a little plate there
That
and a
one.
yoga. Yes, that is it.
All right, just let me know.
Okay, I will. Thank you very much, Jeff.
Sure.
I wanted to mention a couple of the projects that I have worked with in Southeast Ohio. They are diverse. They're a lot different. Sobriety is one of them, where the researcher actually started out in Pike County. And this was a project that made people, or it started in a school to begin with, made the students more aware of sugary drinks and how much sugar is in what we're drinking and why it's important. And it got so popular that a local hospital, they worked with them and they put it into their wellness program so their employees would have a chance to do that. And it's actually like the Energizer Bunny. It's still going on today. And the researcher is working with some facilities and schools in Tennessee to work on this project. Another one is Hep C. We had a researcher from Children's who worked with a local healthcare facility. And his study was regarding mothers, how some pass it on to their babies and some do not. We've had another one called Planning to be Active, and that was actually in the schools with high school students. And teaching them the importance of planning their own exercise and being a little bit more responsible for their health, and that they did not have to join like a gym if they didn't have the money. There are other ways, and we taught them in that project how to identify what's exercise, what counts, like walking the dog, walking to school, riding your bike, mowing the lawn, and taught them how to plan for their own activities. My Plate is a program that went out into the Pike County with third grade, and we provided them with a plate, but also training to teach them about the different food groups and how to plan their own plate. Also, the yoga for children during the summer, they could bring a parent, and it was all free, and they could do this and keep active throughout the summer. We've had, excuse me, opioid projects, the BD Spoke Project, sharing visions and smoking cessation. We've had several smoking cessation projects. So it's a wide variety with a lot of different people. Advanced slide. An example of what I like to call started as a casual conversation. Our advisory board at the end, like I said, we always kind of network at the end of the meeting. Some people stay, some people will go ahead and go on. But there was one identified issue that we had here in Southeast Ohio was our Hep C numbers were extremely high. And so it came up that, we need to prepare, because as this Hep C community starts aging, they're going to start having more and more problems. So we need to be looking down the road. And they's like, we want to do something, but we don't know for sure what it is and what it's going to look like. So they asked if we could educate the group, because this group is diverse. Some have been involved with research and some have never been involved with research. So I started reaching out at OSU to researchers to find some who had been working on Hep C and asked them to come talk to us. And as they came, we had various ones. We had, like I said, the researcher from Children's that had been working on Hep C with the mothers and the babies. We also found another researcher at OSU, Dr. Syverson, and she came down and met our group and was very interactive, and she got on the bandwagon with us. And so she started doing some preliminary little surveys, having meeting with groups meeting with people individually or in a group, and collecting information and opinions. And this information was actually used by Dr. Miller to get an R21, and he got a bigger project to work on. Next slide. The other thing that is really wonderful about being with the CCTS, we are a part of a larger network, which is called the Appalachian Translational Research Network. You'll see here is a web page, and they address the health challenges and disparities specific to Appalachia. And by becoming a member, there are some valuable things that you can acquire to help with your research, especially if you need to reach out to others in other states. But there is a membership, and you can have access to a biannual newsletter. We get to hear about others' activities that have been going on and keep each other informed. We also have an annual health summit, and this is yearly, and actually it's coming up next week, so you still have time to register if you're interested. And this is rotated through the different institutional partners. And this also allows us to have collaboration with other ATRN partners. There are 9 of them. You don't have to do all 9 at once. You can pick wherever you need to go, but you can collaborate with others. Next slide. Here are our institutional partners: Ohio State, OU, Cincinnati, Kentucky, Marshall, Penn State, Wake Forest, West Virginia, and Virginia. So we're in several different states, and sometimes we can get together and work on a project, and with the COVID issues that we've all had to deal with, that was one of them that they picked that all 9 participated in. And they thought that was nice that we could work together on a project and collect information that was needed. Next slide. As you know, the Appalachian region is really huge. It goes from New York all the way down to Alabama, Mississippi. And of course, in Ohio, we have our section of Appalachia. I think the only one that a whole state is in the Appalachia area is West Virginia. Next slide. And in Ohio, these are a listing of all of the Appalachian counties. Next slide. And within these, you'll see the highlighted list, and then you'll see the red collared counties. These are the ones that we've had projects in. And we're always open to doing any of these, but this just happened to be where the different audiences, communities they were wanting to work with. Next slide. So like I said, the COVID survey was a collaboration of all the institutional partners, and they came up with this survey, and they sent it back to each individual institutional partner, and they distributed those. And we thought that that was best, because that way, when a survey is being sent out to people, they got to see a familiar name so that they knew, were familiar with who was sending the survey, versus if somebody in North Carolina sent you a survey here in Ohio, you may skip over it. But we got results, and actually this is going to be discussed at our health summit next week. The group that helped put this together and did the analysis, they're going to be discussing the results at the health summit. So another reason to go to the health summit. Next slide. Here with the CCTS community engagement, we do a wide variety of things. I really don't like making a list, because I'm afraid someone will think, oh, well, what I needed isn't on that list. What I say to people is ask me, because I would love to have the opportunity to be able to try to help you. And so we assist the research community by reaching out to the Southeast communities. And we help the communities reach back to the research community at Ohio State. And there are a lot of needs and health disparities here in Southeast Ohio. And we know that if we're together, we'll be stronger and can accomplish greater solutions for our disparities in Southeast Ohio. We can develop practices and build networks of resources so it can benefit all of us. Next slide. And we do have a community engagement team. You heard from Jeff earlier, and our director is Pam Salisbury. So if you ever have any needs, please feel free to reach out to one of us or all of us. We would love to be able to help you with your research projects. Thank you.